Hello, everyone. Welcome to our 2022 speaker series. I'm Tara Vogel, NDF's Patient Advocate Program Manager and a board member. And I'm very pleased to welcome you here today with us today. Backed by popular demand by our GNEM community is Sogol Ash. Sogol has been a part of the fight for GNE myopathy for over 5 years, serving as an ambassador, board member, and gala chair for NDF. Sogol is passionate about helping people reach their most optimal state of well-being. She incorporates naturopathic medicine, functional nutrition, fitness, and mindfulness techniques to create your unique recipe for wellness and guide you to live your most optimal life. Sogol is a holistic wellness coach and preventative health specialist. She received her master's degree in global medicine from USC's Keck School of Medicine and her undergraduate degree in health promotion and disease prevention from USC as well. The Neuromuscular Disease Foundation is pleased to present a live presentation and question and answer session on naturopathic medicine approach to digestion, pain, and inflammation. We are grateful for your help, Sogol, and now I'll turn it over to you.
Here we go. So, an overview of what to expect today. So I'm going to tell you a little bit about naturopathic medicine. We're going to talk about the connection between digestion, pain, and inflammation. We'll talk about intestinal permeability, aka leaky gut, which is the popular term these days. We'll talk about feeding our microbiome, therapeutic foods and cooking methods for weight loss and detox, how to fight disease with phytonutrients, some triggers and mediators of chronic pain, and then I'll give you guys some natural modalities to relieve pain. So just a disclaimer, none of this is medical advice. I'm just kind of presenting our research-based information, and you should always establish care with a healthcare provider if you're trying to treat a medical condition. If you know me, you know that I always like to take a mindful moment. So if you guys could please close your eyes. Just take a deep inhale and a deep exhale. Start connecting with the chair, the bed, whatever you're sitting on. See if you can just release whatever you were doing before, whatever you're thinking about, worrying about, and see if you can start opening yourself up to receive what you're going to hear today. And if you can just sit here for a moment and take another deep breath. And whenever you're ready, open your eyes and try to bring yourself to this present moment. Okay, so what is naturopathic medicine? So a lot of people don't know, so I wanted to just give you a quick intro. So we are a healthcare profession that combines the wisdom of nature with the rigors of modern science. So we address disease and dysfunction at the level of body, mind, and spirit. We try to treat the root cause of disease rather than suppressing symptoms. And we harness the body's inherent wisdom to heal itself in order to guide our patients to wellness and total health. And we use a whole-based approach, and we seek to restore balance and health by using that whole person-based approach. So we basically try to treat the whole person by digging into your body, mind, and spirit, and what lifestyle habits or what triggers throughout your whole lifetime, even before birth, so from when you were in the womb, could be causing your issues today. And these are just the principles of naturopathic medicine, a little bit of what I said. First, do no harm, use the healing power of nature, identify and treat the causes, doctor as teacher. We do a lot of education, which is why I'm here today. Treat the whole person, and prevention. So I first want to talk about how digestion, pain, and inflammation are all connected. Everything is going to start in our gut. Our digestive system sets the scene for optimal well-being. So if our digestive system is not working properly, it's going to lay the foundation for disease. This is a little bit of a diagram I made for you. So if we have a compromised intestinal barrier or dysbiosis, which I'm going to get into, it can cause systemic inflammation. So systemic meaning whole body inflammation, and that can lead to chronic pain. Obviously, it's not the only way that we have pain. There are other ways that we get pain, of course, injuries, disease, but this is just one other aspect that can also fuel the fire. So let's talk about a leaky gut. We're not supposed to call it that as doctors, but that's the trendy term. So we call it intestinal permeability. So our intestines are protected by these tight junctions. I don't know if you could see my cursor, but if you see how closely packed these are in a healthy gut, these tight junctions allow for good things to come in and they keep the bad things out. But when the integrity of this barrier is compromised, we basically get like most of the health issues that we have. So a lot of negative health effects can come from this. So if you could see here how all these bigger proteins and toxins are now getting into our bloodstream, and that's not what we want. And this zonulin is just a marker that shows when the lining is compromised. So on labs that just elevates. Okay, so what happens when our intestinal barrier is compromised? We get immune activation. So when all these things that we just saw, these proteins and bigger molecules are in our bloodstream, it activates our immune system because our immune system is doesn't recognize these things. And so it sees them as foreign, but that's when it can start attacking itself and cause autoimmunity. Does this mean that everyone's going to have an autoimmune disease? No, but again, another method. We get an increased uptake of food antigens. Similarly, our immune system is becoming reactive to these food particles that can now pass through the lining. So if you start seeing that you're all of a sudden reacting to foods that didn't bother you before, so maybe gluten, dairy, anything, basically, this can be a big cause of it. Malabsorption. So we don't absorb our nutrients as well when our lining is compromised. That leads to nutrient deficiency. So you may be eating the right foods, but you're malnourished because you're not absorbing the nutrients from them. And it can cause fatty or greasy stools. We get an increased uptake of toxins and LPS, which is lipopolysaccharide, which we can get into in another talk, but that is going to increase our whole body burden of toxins, again, leading to chronic disease. Chronic inflammation, which is an underlying factor in most health issues. And then it'll increase our oxidative stress, which will allow harmful free radicals to just hang out in our body. And then ultimately, we're going to get DNA damage. So that can lead to changes in our gene expression and then disease. Okay, so damage to our intestinal barrier can be caused by so many different things. First and foremost, pathogenic infections. So bacterial, fungal, viral, parasitic. So you can have parasites. We can have, a stomach virus, fungus, so candida, any bacterial infection, various medications. Two of the big ones are antibiotics and NSAIDs. So a lot of us take, Tylenol and things like that, often for pain. These can always damage our lining. And there's a lot of research coming out on the potential, the negative effects of these on our digestive system. Stress is a huge one. If you've come to my talks before, we've talked a lot about the brain-gut axis, mind-body medicine, and how we have a whole other nervous system in our digestive system, the enteric nervous system. So any sort of stress is going to trigger these inflammatory markers. Toxins, so things like pesticides, plasticizers, heavy metals, environmental pollutants, molds, things like that can damage. Any kind of long-standing inflammation that you've had, alcohol, smoking, of course, that goes to say with a poor diet as well. Nutritional insufficiencies, like we said, an imbalanced diet. So eating more processed foods, not actually eating the nourishing foods that we need. Processed and refined foods like sugars, eating things with food additives, which I've talked about a lot. And then any sort of chronic disease. So all of this is going to lead to dysbiosis and a leaky gut. So signs your gut may be leaky. Again, this you can have these and your gut may not be leaky, but often, as I said, the digestive system is the core to our health. So if you have digestive symptoms like gas, bloating, reflux, diarrhea, constipation, or what conventional medicine calls IBS, we don't like that term because it's a blanket term. We like to get to the actual root cause. But if you have a slow metabolism, food reactions, malabsorption, weight gain, a lot of neurological diseases are fixed when the gut is fixed. So ADD, ADHD, depression, anxiety, chronic fatigue, headaches, migraines, a lot of these, I work with a lot of patients with neurological disease, and a lot of things start getting better, especially in kids with ADD or anxiety or depression, when we change their diet and work on healing their gut. Allergic symptoms, like we said, so when these things that shouldn't be getting past that barrier do get past them, it can cause allergies. So people who have constant postnasal drip, frequent sinus infections, chemical sensitivities, they're kind of just reacting to everything. Always want to look at the gut. Hormones, so things like diabetes, increased insulin sensitivity. Again, there's a whole other method by which that can happen, but you always want to look at the gut. Hashimoto's, Graves, and then skin. Skin and the gut are so connected. So if you're seeing things like acne, eczema, dermatitis, hives, rosacea, things like that, again, you want to work on your gut. And then pain, which we're going to talk about today. So a lot of muscle and joint pain, inflammatory arthritis, peripheral neuropathy, a lot more as well, can be caused by this inflammation from the gut. Of course, I'm not talking about, patients with GNEM, myopathy, but again, it's going to play a factor. So if you have this disease, we want to make sure everything else in your body is robust and working well so that we can support you throughout the whole process. So our microbiome is a key regulator of pain. Each person has an entirely unique set of microbes in his or her digestive tract. Environmental exposures, lifestyle habits, such as the ones I talked about previously, can either lead to a healthy microbiome or a harmful one. This microbiome is going to regulate our chronic pain via immune, neural, endocrine, and metabolic signals. Dysbiosis basically is an imbalanced microbiome. So we have more of the pathogenic bacteria that we don't want and less of the beneficial bacteria, which is going to lead to various negative health effects. So you guys asked me to, again, talk about things that we should be eating. So I'm going to bring it back. I tried to change it up from what I've spoken about before. And we're going to focus a bit about on feeding your microbiome that I just talked about, because our microbiome is influenced by the foods we eat. So these are my cardinal rules. Eat real whole foods. So whole plant-based foods are the best source of fiber and phytonutrients. Highly processed snacks and artificial sweeteners are going to damage that intestinal lining and trigger inflammation because they're inflammatory. We want to focus on organic, high-quality foods as much as you can. I know they can be more expensive, but they make a big difference in your health. Buying organic foods, eating grass-fed meat, wild-caught fish, pasture-raised eggs, etc. Unfortunately, conventional agriculture practices cause our foods to be laden with these toxic chemicals that wreak havoc on our digestive tract and lead to disease. Try not to eat the same thing every day. Our microbiome needs diversity. We need to eat a wide variety of foods and maximize our nutrient intake. And again, those microbes that I talked about are going to feed off of these different foods. So if you keep eating the same thing, you're going to promote the same bacteria. You want to eat different things to promote the different kinds of beneficial bacteria. Eat mindfully. We've talked about this a lot. Take a few mindful deep breaths before meals. If that's all you can do, do that. Even one mindful breath before a meal. We can talk a little bit more later about the nervous system, but I've spoken about it, how our nervous system, if we're in that parasympathetic mode, which is our rest and digest, that's the optimal state of our nervous system for us to be digesting our food. But if we're in fight or flight and we're stressed and we're eating while on the go, we're not going to be properly digesting our food. So on that note, we also want to enjoy our meals. Food is meant to be enjoyed and shared with community. So as much as you can, if you can be eating with friends, eating with family, rather than staring at a screen. I know that sometimes we need to do that, but if you can, even call a friend while you're eating. Feeling upset or guilty over our food is going to increase our cortisol levels, and then that can lead to weight gain. So we don't want stress. We want our body to be happy and in that parasympathetic mode. This was in one of my previous talks, but you know your body best. So the biggest rule of all is that regardless of what I say or diet fads or any conflicting nutrition information, you want to trust your intuition. You spend the most time with yourself, so you know your symptoms better than anyone. Pay attention to what makes you feel good and also bad. Try to feel what your body needs. It's constantly communicating with you. So try to feel like, what is my body craving today? Usually a craving is a sign from your body that it's missing something or it needs something. In Ayurveda, we talk about how the seasons, we eat seasonally. So the season is going to change how our nervous system reacts. So it's going to want, you might find yourself wanting more nourishing foods, like more starchy vegetables, because our ancestors, this was their time of kind of going inward and hibernating, right, in the winter. So just kind of pay attention. We want to eat therapeutic foods. So we want to choose high quality, clean proteins. Try to eat, again, grass-fed, organic, non-genetically modified sources of meats, pasture-raised eggs, wild-caught fish. I know you might see a lot on social media about this, but it's really a big deal. In America, I know some people might be joining from other parts of the world where a lot of these toxins are illegal, so you don't have to worry as much. But in America, so many of the chemicals that are detrimental to our health are legal, and our food is laden with them. So trying to just be mindful of that. Genetically modified meats and farm fish, they contain hormones, chemicals that pose a toxic burden to our body, which is going to lead to a higher risk of disease, chronic fatigue, a sluggish liver, even weight gain, things like that. So a quick tip, you can avoid these by choosing 100% organic for plant and animal proteins. But if they're not organic, try to look for at least non-GMO on the label. Bone broth and collagen protein are a really lovely way to get nutrients in. Bone broth, I know you guys asked me about weight loss, so I love bone broth. As long as a lot of this is going to be different if you have individual digestive problems like SIBO, candida, things like that, you want to work with a doctor. But in general, bone broth is one of the most nourishing and healing foods. The best way is to make it, and I can send out a recipe if you want. It can be difficult though. So a lot of places now sell bone broth. Basically, you're getting all the beautiful collagen and protein and just so many nutrients from the bones of these animals. Some tips for including protein. So if you're trying to lose weight, you want to include protein in all your meals and snacks, because that's going to promote satiation and also keep your blood sugar stable, which is a key factor. If your blood sugar is unstable, that's when you get more cravings. That's when you just want to eat more. So try to get lean cuts of meat and remove the visible fat. You can use omega-3 rich eggs from pasture-raised hens as a quick protein source. So a fun way to do it is just have, boiled eggs and keep them in the fridge. That's what I do because I'm on the go a lot. So if I always have those ready for me, when I'm hungry, I can reach for that rather than reaching for an unhealthy snack. You can have cans of wild-caught tuna, salmon, or sardines when you're on the go for a clean source of protein. Again, these are just some staples that you can have. Fats, I've spoken a lot about them. They tend to get a bad rep, but healthy fats are necessary for our survival. They help us absorb our vitamins and nutrients, right? We have fat-soluble vitamins. They create cellular energy, and they help us secrete our hormones and more. Cholesterol is a precursor to our hormones. You want to stick to unsaturated fats, though, especially if you're trying to lose weight. Most people, though, you should stick to unsaturated. So avoiding trans fats, you want to limit the saturated fats. So another tip here, Avoid the hydrogenated fats and oils found in things like margarine, store-bought salad dressings, and other processed foods. So if the label lists partially hydrogenated or hydrogenated on the ingredient list, that's going to contain trans fats. Again, that's going to lead to inflammation and weight gain. You want to increase omega-3 fats from fish and plant sources. So cold water fish like wild-caught salmon, mackerel, sardines, because those omegas are anti-inflammatory. Replace saturated fats with unsaturated fats from foods like olive oil, avocados, olives. And then for medium to high heat cooking, use coconut oil, MCT oil, and ghee. You can also use avocado oil, which I love. These are less likely to oxidize and cause inflammation. Oxidation will cause the inflammation. Here are some tips for you guys as you asked to incorporate healthy snacks. So you can enjoy nuts and seeds as a snack. You can sprinkle them on top of salad, soup, smoothies, spread nut or seed butter on a rice cake and top it with fresh fruit. Tahini, I love. Hummus, again, using olive oil instead of conventional dressings. Make fresh guacamole, add avocado into anything and everything. Add olives. Olives are my favorite snack. Try to limit your saturated fats to 1 or 2 servings per day. And then again, choosing organic, extra virgin coconut oil, same with olive oil. And then you can have some dark chocolate, but 70% cacao. So you want it to be at 70% so that you're actually getting the antioxidants in the chocolate. Fiber. Fiber aids in the removal of toxins, cholesterol, and other waste products through our digestive tract. So it's going to go in there and bind to the bad things. It's the preferred food for the healthy bacteria in our gut, so in our microbiome as well. It's going to reduce inflammation and increase that diversity in our microbiome. So some dietary sources, most fruits and vegetables give us fiber. Cruciferous veggies are a big source, so broccoli, Brussels sprouts, things like that. Legumes are a big one. So things like lentils, chickpeas, black beans, kidney beans, fruits, avocado, pears, berries, and then some grains like oats, quinoa, brown rice. More tips. So super easy ways, adding just ground flaxseed or chia seeds to your favorite smoothie, especially if you're experiencing constipation. These can help move your bowels as well. And then eating your favorite veggies with hummus as a snack, use hummus instead of mayo, make crispy Brussels sprouts, add beans to your salads and soups, combine beans with quinoa or rice and vegetables, adding blueberries to oats, don't eat yogurt just plain, add fruit to it for color and flavor. And then if you're trying to eat fruit as a snack, it's best to eat it with a handful of nuts or seeds, or even just, a scoop of almond butter, because then you're stabilizing your blood sugar again. The fat combined with that fruit is going to help stabilize our blood sugar, keep our metabolism going. It's going to keep us full. Okay, so tips for non-starchy veggies, especially if you're trying to lose weight, you want to focus on eating the more non-starchy vegetables. So these are green leafy vegetables like kale, collard greens, cabbage, bok choy, things like that, most lettuces. And then you can use them as a wrap instead of tortillas or bread. Add greens to your smoothies, to your eggs. Use the leafy green. Oh, again, I already said that, but create a salad with a variety of greens and colorful veggies, top it with lean protein. And then a quick tip is to take time to clean and prep the veggies and store them in glass containers so they're ready to eat whenever you're hungry. So this could be whatever you like to snack on. Carrots, celery, whatever it is, if you take the time to prep them and have them ready, you're way more likely to go for those than the unhealthy snack because it's ready. It's easier to make that healthy decision. Sorry, I can't see my title screen. Okay, here we go. Fermented foods. These are a wonderful way to get nutrients in. They are antioxidant, anti-inflammatory. A lot of research on cancer with people who eat fermented foods and preventing cancer. They're antimicrobial. They can help with constipation, obesity, hypertension, so high blood pressure. Good ways to get fermented foods in are kimchi, sauerkraut, things like kefir, if you can handle that, yogurt, kombucha, and sourdough bread. Sourdough bread is a really nice choice if you tend to love bread. Again, you want to limit the starches like that if you're trying to lose weight. Sourdough bread is a nice alternative. It's still going to have the carbohydrates and the calories, but it also it's fermented. So you're getting some of these probiotics and prebiotics with it. And it's also less likely to aggravate people's digestive systems. We want to fight disease with phytonutrients. So plant foods are full of these phytonutrients. So they're kind of these like small phytochemicals in plant foods, like fruits and veggies. And these chemicals are going to communicate with the cells of our body, and they can affect how they function in a good way. They've been studied widely, and they've been shown to reduce risks of various cancers. I can share studies with anyone who's interested. Antioxidant, anti-inflammatory, anti-tumor, the list goes on. So much more about just, again, what I said, naturopathic medicine, using nature. So eating what we're meant to eat, fruits and veggies. Try to include colorful plant foods in every meal and snack. And then if you can eat 6, I know it's a lot, but try to aim for 6 different color groups of plant foods. So red, orange, yellow, green, blue, purple, things like that, because each color provides different phytochemicals and different benefits for us. And you want, again, that diversity to feed our microbiome. So some dietary sources, this is a very small list, but most plants are going to have phytochemicals. So berries, pomegranate, citrus fruits. Green tea is a huge antioxidant because it has the EGCG. Spinach, onions, garlic. We've talked about onions and garlic, again, about being big for our immune system as well and our digestive system. Again, you want to be mindful of those if you're dealing with things like SIBO. Spices, I've talked to you guys about including spices as much as you can in your food. So cooking with turmeric, saffron, rosemary, basil, each of those have their own anti-inflammatory properties. Cinnamon's a really nice one, also for people with diabetes, and can help with insulin sensitivity. And then coffee actually has nice phytochemicals. With coffee, you want to be mindful of it being organic, because traditional coffee can be laden with toxins, pesticides, and mold. Mold likes to stick to things like coffee and peanuts. So you want to be mindful and try to choose organic as much as you can, especially if you're a coffee drinker every day. I should have made a whole slide on that. But feel free to reach out to me if you have questions about this. It's a passion of mine, because I see so many people drinking just regular coffee every day, and then symptoms start showing up. So if you can try to choose higher quality coffee, it's to your benefit, because if you're putting something in your body every day, try to have the best quality of it. Okay, some cooking tips to preserve our nutrients. So steaming or waterless cooking can help preserve the vitamins and nutrients in foods, using as little as much water, and then cook until the color of the vegetable becomes bright and vivid. For cruciferous veggies like broccoli, cabbage, kale, you can cook them lightly, but if you boil them, it can deactivate their anti-cancer compounds. So we talked about last time about the sulforaphane in a lot of these cruciferous veggies, which gives us so many benefits, but it's also really good for detox, constipation. So you don't want to overcook the cruciferous veggies. You don't want to overcook any veggies, because once they're mushy, you've deactivated a lot of their disease-fighting properties. So nutrient content of foods like seeds, nuts, legumes. I've talked about this in my first talk, I think, soaking your nuts, because you can also get rid of like the phytic acid on a lot of those nuts that can irritate your digestive system. So things like this, if you can't do it yourself, many companies now will say like, raw sprouted almond butter, things like that. So look for things like that. Cooking can increase the antioxidant content of certain foods like carrots, spinach, mushrooms, broccoli, cabbage, things I've listed here. You want to be mindful of apples and cucumbers. If you're taking the skin off, it can reduce their antioxidant content. So you can use a nice veggie wash to just get off, especially if you're not eating organic, you want to wash your veggies in a veggie wash. again, not overdoing it, or using a scrubber with a little bit of the soap, or some people just use, I have some of my teachers just use soapy water, but that's a good way to try to get off the pesticides and things that have been sprayed onto the food. Okay, now we can get into pain, which you guys have asked me about. So again, this is my little diagram. So just a reminder, we talked about this compromised intestinal barrier and our lining being, so those tight junctions become loose, and that's what causes a leaky gut. Same with dysbiosis. If you're not eating the right foods, if you've had pathogenic bacteria, a lot of stomach viruses, you've taken a lot of antibiotics in your life, a lot of different medications, being mindful that these can cause dysbiosis and then lead to that systemic inflammation in the body, because the things that we don't want in our bloodstream are getting in the bloodstream, and then that can cause chronic pain. Some key triggers and mediators of chronic pain. So triggers, we think of, what a trigger is. A mediator is something that's consistently perpetuating the pain. So a diet low in micronutrients, so things that we spoke about, eating essential fatty acids, so those omega-3s, vegetable fibers, and adequate clean protein. Our microbiome, which I've spoken about. So if you have poor digestion, you're not making the right enzyme to digest your food, or you have poor absorption. Assimilation of the essential nutrients, so you're not actually able to assimilate the nutrients from the food that you're eating to fuel our mitochondria and create energy and repair our tissues. I've spoken about the mitochondria before, but they are our powerhouses for energy. Again, if your gut is off, it can damage our mitochondria, because you need to absorb those nutrients from your gut to fuel the mitochondria. And then lifestyle choices that are pro-inflammatory. So they contribute to the ongoing oxidative stress that we spoke about. That's going to further mediate signals of inflammation to our nervous system. And then psychosocial aspects are huge in chronic pain. So having a lack of support, lack of connection, isolation. I know COVID was really hard for people. So hopefully now, maybe even with this, you can be mindful of that, or even whether it's with Zoom, if it's difficult for you to physically get out of the house, as much as you can, connecting with people and having community. And a mind focused on stories of defeat and the belief that the solution is out of their control. We'll talk a little bit more about the role of the mind in chronic pain, but I've spoken about our mind-body connection and how so much of our thoughts are going to be reflected in our physiology. So we spoke about meditation and things like that before in previous talks, but our cells are listening to our body. So if our mind is just kind of saying these negative things and focusing on the pain all day, then it's going to perpetuate the pain. You're sending your nervous system a signal that's saying, I want pain, 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 versus, if you have mantras that are, I am healing, I am well, I am in control, things like that, it can really shift your body's physiology. Some imbalances we see with chronic pain. So again, the gut stuff, toxin exposure can cause pain. Our inability to eliminate toxins. So having poor digestion, poor elimination, maybe there's, viruses or pathogens in your body that you just don't know of, and it's causing things like constipation for you. If you're not eating enough fiber, that's going to affect your ability to eliminate toxins. Structural imbalances. So, things happen, right? Car accidents, things like that. Oxidative stress and inflammation. So everything I say, I forgot to mention before, but everything I say and I do is individualized for each patient. So I'm trying to give a broad overview for the purposes of this talk, but you always want to meet with a naturopathic or functional medicine doctor to get to the root cause of your specific issues, because your life, everything that's happened in your life, like I said, even from the womb when your mom was pregnant with you, is going to influence your individual picture today. And I'm always here for you guys if you ever want to reach out and ask me questions or tell me your story, and then we can kind of get to the root cause. But it's going to be different for everyone. So we talked about this, but the nervous system plays a critical role in digestion and in our pain response. So our sympathetic nervous system is our fight or flight. That's when, originally it's meant for survival when you're in trouble. They use the example of when a bear, comes, like your body is going to shift into gear to run away from that bear, any danger. And now that even includes any sort of stressor in our life. So a lot of people, unfortunately, these days are living in a consistent fight or flight. And the more we can get out of that, the better our health will be. Because when we're in that fight or flight, our body is shunting blood away from places that it doesn't need, like force that imminent danger. So it's going to shunt blood away from our digestive system and send it to our heart and our brain and things that it's going to need to run away from that danger. So the more we can get away from that and be in our parasympathetic mode, which is our rest and digest, the better we're going to experience health. So ways to get into a parasympathetic mode are deep breathing, meditation, whatever works for you. So things like painting. I can send out a little thing on like the vagus nerve and stimulating your vagus nerve, which with things like gargling, humming, because, a lot of our vagus nerve is a wanderer. It kind of starts here and goes all the way, and it's going to affect a lot of organs in our body. And ways to trigger it can be things like humming, gargling, singing, things that are kind of in this area. Deep breathing. That's my favorite for me. But, if you're driving, sing in the car, sing in the shower. I ask my patients to start with 30 seconds a day of gargling, humming, singing, whatever is good for them. That will start putting your body in a more parasympathetic mode and increasing your vagal tone. So the vagus nerve, we say vagal tone because we're creating a more robust vagus nerve. Oxidative stress, I keep talking about this, but where does it come from? Things like toxins, processed foods, genetically modified foods, a high sugar diet. It activates our inflammasome. So that big inflammation picture we've been talking about, a little bit sciencey here, but it can affect our mitochondrial, it can cause mitochondrial dysfunction and then facilitate chronic pain. I've spoken about like how to fuel your mitochondria. And I think my first talk, if you guys want to go back to that, but you can even, I think I talked about eating for your mitochondria because that's going to affect pain. So you want to fight oxidative stress with the things we spoke about: phytonutrient-rich foods, antioxidants, anti-inflammatory herbs, and spices. So some kinetic energy modalities. So these are ways that we address pain and we help enhance mitochondrial function. So we use microcurrent, we use PEMF, biofeedback, neurofeedback. I love cold laser, color therapy, red light, other things you might know of. And then physical medicine. So chiropractic care, craniosacral therapy. I think especially for patients with GNEM myopathy is a wonderful tool. It's super gentle. It's, it's working on the sutures in your brain, and it's working on an energetic form, but it's also like very mildly moving things and can really, really help. I've seen this work wonders for patients in chronic pain or kind of going through anything, even emotional. TMJ, so someone working on your jaw, massage, exercise, which I know can be hard for a lot of patients with GNEM myopathy. So that's why I put all these other modalities here. Acupuncture, again, lovely, lovely tool. Mind-body methods, so meditation, guided imagery. There's so many apps today where you can do guided imagery, or someone will guide you through a meditation, prayer, setting an intention, mantras that we spoke about. If you have questions about these, we can get more into it. I knew I wouldn't have enough time to get into all of them, so I listed them here for you. Pain reprocessing therapy. So we want to work on our mind and shifting our mind. So you want to turn towards your pain and be with it in the present moment and see if you can just be there and not judge it. Try to practice self-compassion and have gratitude, and try to reframe the idea of pain, reducing that fear, becoming aware of fear-based thoughts when it relates to your health or your pain. Focus on the confidence of what your body actually can do, and try to shift from that mode of suffering to empowerment. So when we're aware of these fear-based thoughts around pain or around our health, we first have to become aware in order to shift it. And then we can shift to a more empowering mode. If you have unresolved emotional trauma, that's a big thing I see with patients that can manifest as pain and disease. A lot of cancers, a lot of just so many things I see manifesting into physical symptoms because my patients haven't dealt with the traumas in their life. Some remedies I like for pain. So homeopathy is highly, highly individualized medicine. If you want an individual remedy, please reach out to me. But if you want to get the best benefit, it really should be matched to you by a clinician because it's super specific. And that's why it works, is when it's specifically matched for you. Some general ones, though, arnica, anyone can take because it's good for any pain, muscle, tendon, ligaments, trauma, injury, bruising. We use this a lot for pre and post-op. Rust tox is good for pain that is worse from first motion. So you get up in the morning and you're in a lot of pain, you're stiff, but then you're better from the continued motion. Like you move throughout the day, the pain gets better. Rust tox is great for that. And also if you're better from heat. Hypericum. So hypericum is St. John's wort, which we use a lot for nerve pains because it has an affinity for the nerve. So it's nice for nerve pain. Symphytum for bone pain. So deep bone pain, if people feel that, or if you have a fever and you have that deep bone pain, symphytum is really nice. Some nutraceuticals and botanicals. When I say botanical, we just mean herbal. I listed them here so that if you guys, I think you can get access to the slides, you can look at this later, but turmeric, I think everyone knows by now that it's a huge anti-inflammatory. I put the dosages I like here, and it needs to be standardized to the curcuminoids, which are the active constituent in it. Same ginger, really nice for pain. Boswellia is a beautiful herb I use for pain. Again, you want it to be standardized to the boswellic acid. So whenever it says standardized, we're standardizing it to the active constituent to make sure you're getting enough of that to actually have a therapeutic effect. Bromelain, I think people have heard about a lot too. You want to eat it between meals because that's when it can have its like anti-inflammatory effect. If you're eating it with your meals, it's an enzyme, so it's going to help digest your meals. So if you can have it away from food, that's the best way for pain. Devil's claw is really nice. Quercetin I love. You may have heard of quercetin for the immune system and allergies. It works on so many different levels. And now I give it to patients with chronic pain or my older patients with osteoporosis and things like that. Cayenne, you can make topical creams with cayenne, or you might see it. And then magnesium glycinate. So there's many different kinds of magnesium. Magnesium glycinate is usually the one you want if you're using it for pain. And this is one dose here, but it really depends on the person, how much you can take. It can still, even though this form is more for muscles, it can still affect your bowels and cause diarrhea, magnesium, if you've ever taken too much of it. So this is something you might want to talk to a doctor about, but it can have a really nice effect. Some products I like, I put here, these are some things that I've given to my patients, I've taken myself. So BCQ here is a nice one, and it has a few of the things we just talked about all in one. The boswellia, bromelain, curcumin, and quercetin. Curcumin phytosome here, it's also called, I think it used to be called Meriva, but it has a 1,000 milligrams of curcumin. So that's what we want from the turmeric. Zyflamend is nice here. It has a lot of different herbs for pain relief. A high potency fish oil. I put almost everyone on a high potency fish oil because we all have a deficiency of fatty acids and it's super anti-inflammatory. The dose is going to depend on how much inflammation is in your body. So this 2,000 milligrams is kind of a general maintenance dose, but usually for chronic illness, chronic disease, things like that, you want to go higher up. Again, please talk to someone about it. I love this CBD pain cream. It is super high potency. There's different levels. I use level 5 for people with chronic pain because it just works really well. It's very pricey, but using a tiny bit, like this bottle will last you a while, goes a long way. A lot of my patients have success with this. I've used it. I love it. Tea relief cream here is arnica that we spoke about. Arnica comes in a nice cream, but this also has 12 other botanicals, homeopathics in it. So this works really well. This comes in tablets as well too, if you want to try the tea relief tablets. Some more pain relief. Again, didn't have time to get into all this, but something you might want to discuss with your doctor is low-dose naltrexone. This is actually a drug, but something that naturopathic doctors use a lot because it's super gentle and it's so low dose. So I use this a lot for chronic pain, autoimmune disease, patients with cancer, long COVID, things like that. It's anti-inflammatory. It helps modulate our immune system, and it's found to improve outcomes in patients with fibromyalgia and just chronic regional pain. Oral CBD, you guys asked me about. This is a brand I really like. There's so many more brands out there right now. The dose is going to really depend on your weight, your individual body, your tolerance to it. So again, reach out to me or a doctor for that. Hydrotherapy, I spoke about, I think last time, about doing, the hot water versus cold water. So alternating hot and cold water. Again, that's going to stimulate your metabolism. As a reminder, I think I spoke about if, patients are in a wheelchair, if you're showering or if someone is showering or bathing you, alternating the hot and cold water can help with pain, because when we're using hot water, we're dilating all our blood vessels, opening everything up, sending blood flow. When we're using cold water, we're contracting. So the more we alternate, we're dilating, contracting, it's going to stimulate your metabolism, your immune system, and can really be nice for pain. Castor oil packs, really nice for pain as well. You can kind of Google what they are and how they work. You basically dip this wool flannel, you kind of drench it in castor oil and you put it over the area of injury or pain, and then use it with a heat pack, and you kind of let it soak in. Castor oil has like a lot of beautiful beneficial properties. So I'm just going to take a sip of my tea. I think I've been talking too much. Also really nice for liver support. That could be a whole other session on itself talking about liver support, but castor oil is really widely used in our medicine, and same with hydrotherapy. So some things to think about. And then just a quick slide, because I had to put sleep hygiene in there for pain and basically everything else, but it's just so important because when we're sleeping, that's when our cellular repair is happening. So you want to maintain a regular sleep schedule, try to have a relaxing bedtime routine. Can you take an Epsom salt bath? That's a super bonus for detox. Light a candle, read a book, meditate, whatever your routine is. So many of us now fall asleep, watching TV. I'm guilty of it as well. Working on my computer, things like that. But I notice, my patients notice, when I have my routine, I sleep so much better. I wake up feeling more refreshed. Create a sleep conducive environment. So that means usually a cool room. Don't have other things on your bed. Try to sleep on a supportive mattress and pillows. Be mindful of that. A big one I've spoken about before is finishing eating at least 2 to 3 hours before going to bed, because you want to be able to sleep well. If you're digesting your food, it's going to affect your sleep because your body's focusing on digesting that food. And then moving daily as much as you can, as much as your body allows, avoiding caffeine, nicotine, and alcohol near bedtime. Keeping a sleep diary can be really nice because that's just a free way to start tracking your symptoms and noticing, when I do this, I sleep better. When I do this, I sleep worse. And then considering herbal medicine and things like melatonin. And that's it. I think we have time for questions in a minute, but these are some key takeaways. Microbiome is a key regulator of inflammation and pain. Our digestive system is central to our health, and you can fight oxidative stressors with phytonutrients and food. Thank you, guys.
That was so good, Sogol. Thank you so much.
Absolutely.
So helpful. And, it was so practical as well for people like us, because it's hard enough, trying to eat well, but when you have a chronic condition and you can't move much, it gets even harder. So, trying to lose weight, trying to keep, everything ticking along is so difficult. So thank you for everything that you've just said today. I just want to follow on from something you said about the vegetables. I'm a firm believer in being prepared, and I love my vegetables, but I can't chop them, right? So sometimes it's difficult for me to chop. So what I try and do is at the weekend is try and get my carer or my mother or somebody to help prepare a salad in advance, so I have it ready for the week. So I'm really glad that you said that. But I just wanted to add that, get people to help you chop your vegetables. Don't feel you've got to do it yourself. So thank you for that. Now we have quite a few questions. The first one I'm going to kickstart with is about cholesterol. Are there any natural ways for us to reduce our cholesterol or to keep it in check?
Yes. Okay. So the biggest one is going to be through food and eating fiber, because fiber is going to bind that cholesterol, the ones that you don't want, like the bad cholesterol. And then eating things like the fatty acids and the good fish and things that I spoke about are going to help increase the good cholesterol, like your HDL. There are some supplements I'm like a little hesitant to say, because it really, those supplements depend on the medications that you're taking. But there are some things like red yeast rice. There's so many different things for cholesterol. It also depends, like if you have heart disease or blood pressure, high blood pressure. I'm trying to think how to say this like in a more broad way. Fish oil is a big one for that. Like I spoke about. Let me think about that, because I'm a little hesitant, because I've said this to people before and then they go take supplements and they like mix with their medications. A lot of the things I spoke about are not as big, like they don't mix with medications as well. But I would say diet is the big one. There is one for like also high blood pressure. It's called, I'm trying to think of the name. It's an Ayurvedic supplement I use a lot for my patients. Carditone is nice. The brand I talked about, Thorne, is really nice. They have a cholesterol supplement called, I think it's called Coleast. It has the red yeast rice I just spoke about. That's a main thing we use. And there's a lot of studies on red yeast rice. There's other things like bergamot for high cholesterol. Those are two big ones I use. But again, you want to like look for interactions, reach out to a doctor if you're taking medications and things like that for cholesterol or high blood pressure. But red yeast rice is probably my favorite one. And my big thing is try to use high quality brands like the ones I labeled. They're a little pricier, but that's how you know you're actually getting the medicine, because these are brands that I trust and that are verified and that like naturopathic doctors really trust. So yeah, does that help?
It does. Yeah, that really does help. Thank you for that. And I'm sure we can take a few of these names down and send them on to our guests.
Another one is like there's berberine and niacin. Niacin, you got to be careful because that can cause flushing. So that I would say do that with a doctor. And then berberine is really nice as well because it can reduce that LDL, and it can also help with blood sugar. Berberine has a lot of effects. It's also like antimicrobial. So yeah, I think doing a lot of what you guys said.
Yeah. I've heard a lot about berberine. In fact, the other day I watched it on TikTok and I was thinking I better get some of that. So that's good.
Yeah. Berberine is lovely. Again, you just want to be mindful, like talk to a doctor about the dose, because everything, just like medications, herbs are potent and they're medicinal. And a lot of medications and drugs are now based off of these like plant sterols and things from herbs. So you just want to just talk to someone, text me, call me, like things like that. But yeah, I would say red yeast rice, berberine. Big one is diet. So eat the fiber, like add the flax seeds to your smoothie or to your diet. Garlic is big as well. It's just coming to me. I was like having a moment. But these are big ones for elevated cholesterol.
Yeah, that's fantastic. Thank you. And then we've had a question about supplements. What time of day do you recommend taking supplements? Because one of our attendees has said that they take them in the morning, but they wonder if they're overloading their system and they're not absorbing the supplements. So is there a particular time of day you would recommend them?
Yeah, it's going to vary depending on what the supplement is. So like I said, certain things need to be taken between meals, like away from food. That's going to depend. If your supplements are not something that need to be taken, like at a certain time or something, I would try to spread them out if you can, because if you're taking like 40 pills at once, like you're going to overburden your liver, because your liver has to process everything you're putting into it. So, you can do like certain things like fish oil in the morning and certain vitamins, and also be mindful of certain things that are fat soluble. So our fat soluble vitamins are A, D, E, and K. You want to take those with food. So, or with some sort of fat, so that they are properly getting absorbed. So you don't want those on an empty stomach. I would try to spread them out throughout the day as much as you can, because that way you're giving your liver a break and a chance to process it all. And if you're taking things for like energy or adrenal support, you can take those you want in the morning and, kind of into the afternoon, like up until 2 p.m. So if you're just like caffeine, those things help us with our energy. If you're taking any supplements for that, you don't want to take it later in the day, because then that can be just stimulating your body.
Sorry, I was taking that down as a note. That's really
helpful. Yeah. So I can write this down. I'm happy to write this down if you want. Put it in the chat.
Really, so we have a question about bone broth. You mentioned bone broth. Mm-hmm. Now, is there a limit on the amount of bone broth we drink on the go? And is there such a thing as too much bone broth?
There can be too much bone broth if you have something like SIBO, or it's just going to depend on every person. Some people can handle, 4 cups a day, and that's really nice for them. Some people can only handle 1 cup or half a cup, because it is dense. It looks like just broth, but it's full of nutrition and full of that collagen. So I think my answer to that is really, you have to test it out on yourself. I think too much of anything can be bad. So, start with half a cup. Then I like to have it on, if you can, on an empty stomach in the morning, because you get really nice benefits that way. It's not ideal. You don't think of having bone broth for breakfast, or having a little bit of it before your lunch. So you're kind of priming your digestive system, or cooking food with it is nice. So start with half a cup, go to 1 cup, 2 cups. I have one patient that does, 3 or 4 cups, but it can be a lot. So I think you really got to see what's right for you. I don't think you can overload, I wouldn't go past 3 or 4 cups a day. It can be a little too much, but it's really healing.
Great. And then just following on from that, do you think there's more benefits in chicken broth compared to beef, or vice versa, or is there no difference?
There is a difference. I prefer using red meat. I'm trying to move more away from chicken, just because if you're using lean grass-fed meat, you're getting a bit more nutrition in the red meat compared to the chicken. Not that chicken is bad for you. Either way, it works. I personally believe, and there's research on how red meat just has so many more beneficial properties. And you get a little bit, like when you can get 100% grass-fed meat, you kind of know that that's solid, versus chicken is a little bit more variable. Like, I know it's organic, but I don't know, what it's been fed and things like that. And I know this is like a lot of detail, but like what it's being fed is a big deal for us, because that's what's going into our body. So I would mix it up though. Again, diversity. So never do all chicken or all meat, kind of mix it up a bit.
That's really helpful as well, actually. Never thought of it that way. And one of our final questions, I don't think we have any more, but maybe we will in a bit. But I was just wondering, do you have any tips for any of the patients the women who are perimenopausal or menopausal, on dietary tips for them, please?
Yes. Okay. So that's a whole other talk, and I'm happy to do that talk another time. Dietary tips for them. So what's happening is our estrogen is going down. So eating foods that are phytoestrogenic, certain things like, so soy is a conflicting matter, but if you're eating like really good quality, high quality soy can be nice. There are vegetables that are phytoestrogenic, like you can just Google that. So phyto, like I talked about phytonutrients, phytoestrogenic, meaning that there's like these small, small little properties of estrogen in them. So that can help. A big one with that is going to be the kind of everything I said, like eating that balanced diet and that feeding your microbiome. So making sure everything else is going well. And then doing things like the mindfulness is big when it comes to perimenopause and menopause. Fish oil, I love. There are some supplements. I mean, let me see, that I use. It just depends on your individual symptoms. Yeah. But there are definitely supplements that I support my patients with and through that period, and herbs are really nice. So if you look at this brand called Vitanica is one that has nice things for women. And I'm blanking on the other one. Let me look at it for you. I love this brand for just everything in general, but they're so just Wise Women Herbals. They do a really nice job of kind of everything for women. Let's see, let me show you. Like if you look at them, like they have menopause support because unfortunately, like just the diet is not enough. I use a lot of herbs for that. So things like black cohosh, angelica, wild yam. You kind of need a mix of supplements, diet. It's a whole lifestyle approach for that. Mindfulness, if you can move, if you can do yoga, can do the hydrotherapy I talked about, the contrast showers. All of that is going to support the body throughout that process. And because so much of that picture becomes the emotional picture. And then if you're experiencing things like vaginal dryness and things like that, just reach out to me. There's like just so many other things we can do, a lot of support, but I would definitely say focus on the mind body aspect, eating clean, eating well, like everything I just said. And then, and then like supplementing with some things.
That's good. Yeah. And I think it's becoming such a hot topic at the moment that I'm hoping that people can talk about it more openly, not like our, parents or people before us had to deal with that kind of stigma about menopause. So thanks for that. We do have some more questions.
Go for it.
So I've got a question about nuts. So we eat a lot of nuts. Do we need to be concerned about mold and all nuts, or only peanuts? And if they are organic, are they mostly safe? I hope that
this is also a hot topic right now in at least my world of medicine. It's just so hard that unfortunately it depends where you live. I think in America, there's just a higher chance of it being laden with toxins. Organic doesn't mean it's like mold free or toxin free, but it's reducing the chances highly. If you're concerned about that, try staying away. Peanuts are just more genetically modified and more likely. The mold likes the peanuts a lot. I would recommend, if you're worried about that, like try soaking or sprouting the nuts, and eating organic is as best as you can do. So organic, sprouting, and soaking. So if you have just almonds, like just soak them in water for a couple hours, or some people do overnight. It's really nice because then you can kind of pull out some of the, any pesticides or things, and the phytic acid as well. So yeah, unfortunately, I don't have a good answer because today I was just doing, I'm doing a whole training on detox and toxins and how everything, there's toxins everywhere, and eating organic we just can do the best we can do. And then eating the foods that will help pull out the toxins in our body. So like the fiber and things like that.
Thank you. So we've got a question about probiotic supplements to restore the gut. Do you recommend any?
Yes.
Yeah.
So probiotics, again, it's so funny because people think it's just, take a probiotic, you'll be fine. But they can be so specific for what you're going through. So I would recommend different ones for different patients. But one general one I love that has a lot of the strains that most people need is called Theralac by Claire Labs with a K. I can put it in the chat. Or Therabiotic. I like that one. Complete by Claire Labs. Again, it's going to depend on what you're going through. This is a really good one. Another one I like is Megaspore. That's another one. I think Therabiotic has more of a complete profile. And then if you're dealing with a lot of digestive issues, getting something, this kind of you usually have to buy separate, but with the strain of Saccharomyces boulardii, if I'm spelling it right. Okay. Something with that in it also is wonderful. But yeah, if you take the Therabiotic, that's a really good one. I like very high quality, has a lot of the strains that people dealing with, any sort of issue will need. So
I've just been Googling that. So that looks really good as well.
Yeah. Therabiotic is a really, really top probiotic.
I think we've got time for one final question, if that's okay.
Absolutely.
So one of our patients has asked, and I understand this completely coming from an Indian background, as Asians, sometimes we're not vegans per se, but there's a lot of us that don't eat fish or eggs. So do you have any tips for how we can boost energy or lose weight for people who have those types of diets?
Yeah. So does that mean you don't eat meat or chicken at all, or dairy? What
People
about
don't eat eggs, or they'll eat milk. They'll drink milk or yogurt and cheese, but no fish, no eggs, and no meats or chicken. Yeah.
Okay. Yeah. So focus on, getting your protein from, I'm sure you guys know this then, from plant foods like lentils and beans and things like that, and things that are high in fiber. And then, but like pairing that with, like we said, building like a colorful plate of, so things like having the lentils and that protein with the phytonutrients that can help give you some energy, and eating good fats. Fats are going to give us energy. So eating the good fats we talked about, like the avocados, olives, olive oil, those things help give us energy. Same with the nuts. And then the dairy, try to have, if it doesn't bother your digestive system, having good quality dairy can give you that energy too. It can be a little bit hard with weight loss. It needs to be individualized, for your body. But I think the best way for the weight loss is focusing on the real whole foods. So eating like the beans and things with the greens that are low calorie, and then adding in some phytonutrients in there as well. So like the things I spoke about, like the colorful foods. But the more you want to be mindful, I guess, if you're on that vegetarian diet, of the starchy vegetables. The sweet potatoes and things like that will give you energy, but they can also, you don't want to overdo that. So it's about being mindful of how much of the starches, like the carbohydrates, you're eating. So try to focus more on the plant sources of protein and good fat, and then the leafy greens, and then have a little bit of starch in there to keep you full.
Just following up on that. I know I said it was the final question, but
no, it's okay. I have time.
With our muscle disease, we always think, well, we eat a lot of protein, that's going to help our muscles, which is true. But there's only going to be a certain proportion of that protein that we're going to be able to absorb and digest. So, there's a little bit of a myth, I believe, where people will just eat loads of protein. But is that a myth? And should we only be, is there a certain amount of protein that we should make sure we eat per day, and not get too worried about eating like lots, like what weight, like the bodybuilders have those powders and everything. People can get a bit carried away. And I don't know if that's just a myth, that we only absorb a certain amount of protein.
I mean, if you have a robust digestive system, you'll be absorbing like most of, if it's your digestive system is working, you're going to be absorbing the protein. However, you can always overdo it with everything. So it's the balance I spoke about. I think I know you guys asked about like how much protein, fat, and things we should be eating. I didn't include that though, because it really varies for everyone and it varies for what you're going through. So, certain people like are going to need, like you said, you guys need higher protein, but each person, their plate might be filled with a different amount, 4 ounces, 6 ounces, 2 ounces. It's just going to be different for you guys. So I would have to, I don't want to give you guys like a blanket statement on that, but you know your body best. So you're going to know how you feel with how much protein you eat, but you need to pair the protein. You need to have the balanced plate. So you need to have the protein with the plants, with the veggies, the leafy greens, things like that. And have some fat on your plate too, whether it's olive oil in the dressing. So you want to have the balance. But in general, we say like, you want most of your plate to be colorful and plants, and then the protein and fat. You don't want the whole plate filled with just, meat or chicken, because then you're missing key nutrients. So it's the balance of it. But if you guys know that you need protein, eat your protein. Just try to eat good quality protein. If that's what fuels you, I'm similar. I eat a lot of protein. I did vegan for a while, and it served me for a small period of time when I needed to kind of, cleanse my body and give it a break. But then I was anemic and super weak. So I know that my body feels better with protein at every meal and every snack. And that can be like a little piece of cheese for you, or the nuts, because nuts have protein and fat. But do what's right for you. But just, I would say, balance it. Balance at every meal. Try to have the colors.
Yeah. That's so good. And I could talk to you all day, but I know that we've got to all leave now and give you some rest. So thank you. I'm going to pass you back to Tara, and she'll conclude our event. Thank you.
Of course. Thank you guys for being here.
Thank you very much, Sogol. This was a very useful and impressive session again. And thank you everyone for joining us today. Please join us next week. We'll have a patient huddle where Lizette, a caregiver, will be talking about nurturing the relationship between the GNEM patient and their caregiver care partners. So join us next week. It's open to the public. Share it with your loved ones and patients and caregivers, and join us again next week. Thank you very much. Take care. Bye-bye.